Hi guys, so today we are doing a PRF under eye rejuvenation treatment for one of our patients, and for those of you who don't know what PRF is, it's called platelet rich fibrin. So what we do is we take your blood, we spin it, so we separate the red blood cells from the plasma, and the plasma that's in your blood contains all the growth factors, cytokines and immune cells which we use to help stimulate collagen production under the skin. But to take it a step further, what we do is we mix the plasma with a little bit of clotting factor so that it forms a fibrin gel, and that allows us to not only have all the rejuvenating benefits that we have from the plasma, but it also gives us volume restoration as well. So once we inject it into the patient, we can use it in areas like the mid-face and the under eyes in order to help address hollowness in that area. But not just the hollowness, also fine lines and wrinkles, skin rejuvenation, skin elasticity, and it really helps with all those aging signs that we see when we age.
Hi, how are you?
Good, it's lovely to see you again.
Lovely to see you too. I'm so excited for today.
So today we're going to do some PRF under eye rejuvenation. I understand you've had some tear trough fillers under your eyes before.
Yes.
And we've had them dissolved, haven't we?
Yes.
Great. And so now we have a little bit of hollowing that we want to address, okay? But it'd be good to understand from your point of view what we're sort of looking to achieve with the treatment today.
Okay, so if I'm honest, the area that I'm most insecure about on my face, I've had really hollow under eyes since I was a kid. I've had dark circles. Yeah, needless to say, quite insecure about it. Hence why I went down the filler path in the past, which now we know not a lot of people, or a lot of people aren't great candidates for under eye filler.
Yep.
I was not a good candidate for under eye filler, so I started getting lumps over time, which fortunately I've now had dissolved. But yeah, looking into different options, I've heard amazing things about PRF under the eyes, so I'm really excited to try it today.
Great. Okay, so first thing we're going to do is we're going to pop a little bit of numbing cream just where we're going to insert the cannula. Okay, so these are the two tubes that we have, and you can see one is red, one is blue. The blue one contains liquefied plasma. So you can see here the tubes have a special substance in here which completely separates the red blood cells from the plasma within the blood. So even if I tip it upside down, the two don't mix. And this is where the majority of the PRF is going to be made from. This one here you can see is clotted, okay? And what we're going to do is we're going to dislodge some of this clot, and it will leave around a little bit of fluid which will contain a lot of clotting factors within this. 1 ml syringe, we're going to take 0.9 ml, and we're going to take 0.1 ml from this, mix them together just before we put it in, and by the time it goes into the patient's tissues, it should start clots forming a fibrin gel which produces nice volume in the face. What we want to do is we want to just dislodge the clotted plasma slightly, because what we want is the liquid which you can see just there, which contains all of the clotting factor, which is going to turn the plasma into a gel.
Wow, I'm in shock. That's a big difference.
So what we're going to do now for Georgia is we're going to use some of our PRP. Now this has a whole bunch of growth factors, cytokines, immune cells, and when this gets put into the skin through little channels that are made with the microneedle, it's going to stimulate a whole bunch of collagen production, and it's going to help tighten the skin, produce collagen, and help with all any fine lines and age signs that we see with aging. All right, Georgia, so your treatment is finished. Here's
So
the mirror.
excited to see. Oh my goodness. I can't believe what a difference this has made.
Huge difference.
When I came in here, I had hollow under eyes and I really was bugged out by my nasolabial folds, and it's all gone away. That's amazing.
The eyes look great, actually.
Wow. So exciting. Thank you.
My pleasure.